So welcome back everyone. So in this topic, in this video, we are just going to discuss about the applications of AR. In the previous video, we saw about the applications of augmented reality. In this, we are going to see about the virtual reality applications. So let me start with the introduction part. We already know what is virtual reality and what is the difference between augmented and virtual. Augmented is you will be in a real world. Some additional components of say like computer graphics or any kind of images or videos can be added in the augmented reality with the real world. So combination of real world and digital world is called as augmented reality, whereas virtual reality is nothing but you people will be directly you have an immersive experience that you are in the virtual world. So that is the difference between AR and VR. So how we can accomplish this task is with the help of the head-mounted display, where you can see it in the image. The person is wearing it, which is available in different sizes. And why virtual reality means it will give you the risk-free simulation in any domains, and say for example for military purpose or for healthcare for the surgeon who is going to do the operation. And next is extended reality foundation. It forms the basis of augmented reality and the extended reality application in the modern medicine field. Okay, so next we are going to discuss about how this VR is revolutionizing in the medical training. In just we discuss about the AR part, and now we are going to discuss about how VR is also useful for this medical training students. So the first thing is virtual operating rooms. So assume that a doctor is going to do a surgery. How the surgeon, with the help of using the virtual reality model and comparatively, you can compare it with the traditional way. So if the operation is a risky one or a complex one, with the help of VR, for sure, he or she can uh, uh, save the patient, patient. So surgeons practice complex procedure. Easily he can practice the complex procedure in the risk-free virtual environment. So, with the help of new techniques, he can reduce the medical errors, and he also can improve the patient outcomes significantly. And the next thing is interactive 3D anatomy. We already discussed this in AR application. 3D anatomy, 3D holo 3D model we are using here. So, which will be used very much useful for the medical students who are all studying about who can study about in different angle. He can see the body in a virtual manner, and he can easily identify where the veins or internal veins are there, which is much better than compared to the textbook practices. The next is enhanced learning. So these applications like anatomy 4D demonstrate how the VR increases retention rates by up to 75% compared to the textbook manner. The next is how it will transforming the surgical procedure. So, like say for example, if it is a remote surgery, the expert surgeon can also be participate inside this complex surgery. He can also take some specialized care to the current surgeon who is doing the operation, and if he is in any region, can be connected with the particular surgery. So that is how this VR is useful for remote surgery. And real-time imaging, you can use this MRI and ultrasound images directly onto the patients through this VR headset, which will provide the surgeon with some X-ray vision during the operation. And the next is for robotic assistance also. If you see in the picture, a human is there and a robot is there. If suppose the surgeon missed or anything, he is doing it in a wrong way, the robot is easily can guide the surgeon. uh, for example, if any kind of joint replacement is surgery is going on, the robot can easily help the surgeon. And how this VR in patient therapy and rehabilitation, this we already discussed with the AR. The same, somewhat a kind of different thing here. The components will be differ compared to the augmented reality. So PTSD treatment, which means you can see the veterans or traumatic patients. For those kind of people, this therapy kind of therapy that VR is providing, it is much satisfied for the patient. And same as AR, it is used for stroke recovery. And the next is for dementia care also. VR is very much helpful for the patient. And pain management and anxiety reduction, this we already seen. So 24% pain reduction will be there, which will averagely it will decrease the pain perception during the medical procedure as compared to the traditional way. And 40% sedation giving can be reduced with the help of using VR. If the patient is inside the virtual environment, he or she can be uh, the medicine, sedation medicine cannot be, it can be reduced to a certain part. And the next is anxiety relief. So 65% of the patients or the users are using this VR technology to reduce the anxiety during the surgery. And how it is VR is supporting the healthcare worker wellness. So, as you all know, for the mental high pressure handling medical professionals, the VR will also be used to mental health breaks during the demanding shift basis. The people will be working. So, to reduce the high pressure, the VR is predominantly they are using it. And for virtual healing, it is also used. And the proven result here is Project Star demonstrated measurable stress reduction among the healthcare workers using this VR wellness interventions. And the next, what are all the challenges and future directions? As you all know, the current barrier here is all the user cannot be purchasing this VR since it is highly cost effective, highly cost, and limited accessibility will be there. And as I said, data is also a problem here. Data can be, data breach can be happened. And as you all know, AI will also be getting integrated with this VR technology. And we are using this, expanding this application with the in the telemedicine, mental therapy, mental health therapy, and revolutionary surgical innovation. And what about the future of virtual reality means? It is obviously going to be a big one, big thing in an educational revolution. And for the patient care also, we are using this enhanced treatment. For the enhanced treatment, VR can be used. And for the continued innovation, we need the help of this VR, and which is also support both patient recovery and healthcare worker mental health. And at last, we will be seeing about the mind map for the applications of VR. So far, whatever the things we have discussed, that can be formed in a pictorial representation for improvising the memory of a people. So thank you once again for all the audience for listening this video. So let me come with an interesting videos topics for the forthcoming videos. Thank you.